and students and whoever is joining us today. I really appreciate you joining us today. We're the AmSECT Quality Committee, and I would like to thank you for having us. And we're here to talk to you today about perfusion and quality and why it matters and why you should care as a student. But first, let's introduce ourselves. We are a bunch of people that make up the AmSECT Quality Committee, who come from all different backgrounds and have come together with common goals to help out and assist the perfusion community with quality. We have me, Allison Visner, work at Mayo Clinic, Arizona. Today on our moderator team, we have Tammy Atwood, who's the chief perfusionist at Henry Ford, Jackson Health in Michigan. Jillian Holler, adult and pediatric perfusionist at Atrium Health and the Carolinas Medical Center. Jeff Shores, Director of Operations at Ascension Health in Michigan. Alan Hunt, who's the VP of Operations and Perfusion Solutions. We make up a majority of the AmSECT Quality Committee. We're missing a couple of our team members, but we're here to teach you hopefully about quality today, and that's one of our goals. So here at the AmSECT Quality Committee, we have a mission, and our mission is to develop and make available valuable resources for the perfusion community, which includes educational materials and standardized quality markers and indicators that are aimed to improve patient care and outcomes for not only the students, but for all of our perfusionists. With a vision to have a community that can use these processes to optimize and improve patient care. Working together is our own goal. Yeah.
Cannot see your presentation. Are you presenting?
Yeah. Huh.
Okay. Just so you know, we can't see it, so you might want to share it.
Does that work now?
I'm starting to see it, yes.
Okay. I'm so sorry. Okay, so can you see that, Jeff?
I can. Thank you, Allison.
Sorry, you missed all those great slides. We can actually go back if you would like. So this is our committee. And we just wanted to introduce ourselves with our mission that we just talked about. And then our vision is to, let me get that out of the way. Okay, our vision is to have a community that can use these processes to optimize and improve patient care, because working together is our #1 goal. So let's talk about why we're having this webinar and what advancement and betterment of the practice may look like and how it involves all of us. So here at the AmSECT committee, we have a commitment to engaging all perfusion students to fulfill our mission and vision for the perfusion community. We want to foster a sense of community advancement in this field of quality and provide resources for all to make sure all of our future is bolstered and enhanced by each other by promoting quality and safety. And that's why we're here today. We want to talk to you about quality. So at its core, quality can be described and characterized as a degree of excellence something has when it's compared to something else, especially. What apple is brighter and redder and greener and more delicious? It can be quantified as what you desire, the outcome that you're looking for. And, examples of that, of course, are all around us, just like the apple, but they're also from the water we drink to the buildings we spend most of our days in. The quality of these matters are important to us. And even though we might not always think about them, they're always there. They're important to our safety, our health, and our well-being. And because finding this degree of excellence or mark of high quality leads to greater accomplishment and better outcomes. So you want quality in healthcare. This is why we're searching for this quality and degree of quality in healthcare. Because quality in healthcare has many definitions. But the National Academy of Medicine describes quality as a degree to which health services for individuals and populations increase the likelihood of desired health outcomes, and they're consistent with current and professional knowledge. At the core, quality improvement is a framework used to systemically improve healthcare. This is saying that we need to strive to improve and keep up what is best for the patient. We cannot be stuck in this loop of like, I've always done it this way and I will always do it this way. The practitioner needs to be open to improve and involved with statistically sound findings. But how do centers and hospitals measure quality? Or how can a practice say our results are so good? Or ensure they have these best outcomes or use the best techniques, There's a couple ways centers do this to be accountable to themselves and patients. Some of the ways to do this is by measuring quality is through internal quality measures or metrics. These measures are usually practice-based metrics and are used as tools to assist in like good decision making. They're done internally to measure and quantify different processes, outcomes of patients, patients' views, organizational structures, with the goal of improvement of the whole practice. Another way quality is measured in healthcare is by independent quality commissions. One prominent one is called the Joint Commission. The Joint Commission is responsible for the accreditation and certification of more than 22,000 healthcare facilities and is required in most states for Medicare, Medicaid, and a lot of commercial insurance reimbursement. So a lot of hospitals need to have this little check mark to say, okay, we are going to be able to reimburse you because you have these high quality of measures. The Joint Commission goes around to these hospitals and healthcare facilities to perform a survey or kind of like an inspection on performance, quality, and outcomes that are specific for the accreditation desired. The Joint Commission has standards it wants you to follow. When they visit, they are seeing how the hospital and practice adheres to these guidelines, usually by tracing current and past patients' courses of care. They can also be disease-specific certification or just kind of like bad certification, whole hospital certification. There's different kinds of certifications that they do. But of course, they have a mission too, and their mission is to continuously improve healthcare for the public in collaboration with other stakeholders by evaluating healthcare organizations and inspiring them to excel in providing safe and effective care of the highest quality and value. Now, all these things are all quality and value, and moving forward, it's because we want to and make sure that we are maintaining what is best for the patient. And you're going to hear a lot about money and quality throughout your career, because quality in healthcare sometimes is actually always usually measured by money and performance. Insurance-based performance measures can equate to monetary reimbursement for your hospitals and centers. We'll go over these more in depth later, but they can be used to effectively promote quality measures in healthcare. Basically, insurance is saying, if you meet these quality metrics, we will either give you a discount or a reimbursement kind of benefit. So also to help measure quality in healthcare, you can also join national registries and participate in them. It's a good way to help improve quality and benchmark outcomes in your facility. Participation in these registries can help showcase areas that your center might be excelling at, and maybe where you can help other centers improve their care, and areas where you might need to have more improvement. And it can really highlight those areas where the quality can be improved upon. So now that we talked about quality in healthcare, and it's always evolving, do you think quality improvement has happened in perfusion and cardiac surgery over the years, in the past 10, 20, 50 years? Well, yes. As students, you definitely know that, because you probably fill your day studying, classwork, learning all the great things. And I'm sure at this point you're asking yourself, I'm exhausted. Why do I have to care about quality improvement at this stage in the game? You know, I'm continuing to learn. But the thing is that quality improvement's all around you. You know, you're continuing to learn and about great things. And the thing is, you're learning about the things that we're no longer using. We're no longer using cross circulation or huge cardiopulmonary bypasses or bubble oxygenator, heart lung machine. We are not using these equipment anymore. We are learning about them, and we are using what we have got to an advancement to help the practice and the people that we take care of. We are learning about the growth in the field and the major developments and advancements we have to get to where we are today. And that didn't come by just overnight. So we feel like as students, you really are a core piece in this quality, because as a student, you come into this field and hopefully are going to take on the world, but take on the world and start with your practice and start with what's around you. Presently, you all provide a fresh and new perspective. You're questioning and constantly building upon the knowledge you have, and we love that. Whether it's during class or going out in rotations or getting your first job as a perfusionist, each one of these scenarios allows you to be inquisitive and listen to yourself and take possible questions and concerns to heart. We want you to take some of those questions, concerns, and ideas and maybe further them. Do you understand what's in your prime and why each component is beneficial? How does your center determine acute kidney injury after bypass? These questions allow you to have accountability in your practice and explore more options to provide better outcomes for your patient. And maybe in questioning these questions and thinking about quality and having more quality in your own practice, there's maybe ideas for you to pursue farther to improve quality as a whole. So AmSECT speaks about this responsibility that we're talking about, that we all have to be accountable. This responsibility is written to the AmSECT standards and guidelines for perfusion. The AmSECT standard number 17 states, the perfusionist shall actively participate in both institutional and departmental quality assurances and improvement programs. This includes all of you, and it's going out. But once we started asking questions and take some steps forward, we don't have to take on the world. We don't have to be like the problem solvers of the world right away. We don't want everybody to get overwhelmed. You don't have to start out right away out of the gate. These big questions and concerns and ideas that you may have can be broken down or have lesser starting points. Maybe you have ideas about looking into acute renal injury or how renal function is with your practice and how you can better it. But maybe it's too big of an idea to take all at once, and you try breaking it down into smaller chunks and speaking to other specialists to see what they can add to your practice. And you guys work together to increase those rungs and be able to succeed together. As these smaller victories you want to have in your search for quality improvement. So now let's talk about how you get involved in sustaining quality in your training. Simple answer is to start investing in quality practices and finding ways to improve your practices like we've been talking about. But I'm guessing you guys are doing this almost every day while you're in school. I mean, every day you're improving your skills, you're improving your knowledge, you're becoming a better perfusionist, you're becoming a better student. You're getting more prepared for this world of being this amazing perfusionist who's eventually going to provide quality care for your patient. But, small ways to start answering these questions and working towards a process of improvement is to work with something called the PDSA cycle, the Plan, Do, Study, Act cycle. It's a commonly used tool in healthcare that utilizes 4 steps to improve processes or implement change. And it's a good way to start. To run it down pretty simply, a great way is to start with plan. You start answering these questions and working towards process improvement. You're going to plan. You're going to devise a plan. You're going to develop a plan in which your objectives are clearly defined. This is where you're defining the who, what, when, where, and why of your plan is to take place. What do you want your plan to do? When you work on strategy, you be concise, you talk with your resources, you find resources. You find out what you need. Do you need approval? Do you see what your permissions are needed granted before you can start working on your plan? This is probably one of the biggest parts. And the fun part is the do. You're going to implement what you want to do. This is where you implement your plan, your change, you have fun, you enjoy what you're doing, you start to see if this can really make a change. Next is study. Study, you're going to review and put together your data. You're going to enlist help from other hospital staff and resources, anywhere from research coordinators, perfusion directors, co-workers. You're going to, if they need help to help you analyze any of your results that you get. When I was in school, we did a test on coagulation, and we got a lot of people from lab because they are so smart and a lot smarter than me to help us, untangle all of our results and put them together and come to find out that, what we needed to have our end of our quality marker that we needed to get to. So once you've analyzed this data during this phase and start to understand the impact of your change and possibly identify if the change is necessary. Next is ACT. You're going to act with these results. You're going to present your findings to your team members, and based on your findings, you may act to fully implement the change, make adjustments, or scrap the current plan altogether and start again. But defining changes to the study if needed. But the important thing to remember is that this strategy allows for one use of the cycle. You're able to go through it again and again while fine-tuning your quality improvement projects and gaining more resources and finding more resources and doing what's needed to do to be successful. So a big thing is once you're on the path and you want to participate in quality improvement is finding resources. This will help you with your endeavor and for helping you be more successful. I'd like to show you that resources are available to you in all facets. Even as a student, you can start looking at resources at your school. Begin by talking with your professors and your administrative staff for potential resources and opportunities. There are probably various research and quality improvement projects to participate in and around the campus that you just don't know about yet. And just by reaching out, you'll be able to participate in those. And make sure you're not only looking in your department, but collaborating with other departments at your school. I think our school had a biomed department, which was a treasure trove of information and helpfulness when we wanted to go and look for quality and research projects. Also inquire about what research databases your school might have or actually be a part of, and that you can actually utilize to help with your project. All of these could put you on your path to success, even at school. Another great place to get involved is when you start your rotations. There are usually lots of avenues to get involved during rotations at the hospital. I think this was new to me when I started going out there and being a student. I had no idea what the avenues that were available to me. But I would start by trying to talk to your preceptors when you get to your new hospital. Hospitals and departments usually have weekly, bi-monthly, or quarterly meetings concerning certain departments, work groups, or even research meetings. It's easy to get involved in these meetings, and most of the time you just need to show interest or initiative to start attending. And remember, you always have to ask if you can attend, because some of these meetings are closed. These meetings offer an insight to how cases can be scheduled, how practices are run, and in most meetings, different types of quality metrics are discussed. It could be that they're discussing a patient that has passed, and if there's anything they could have done differently, or discussing how better to identify kidney dysfunction for emerging new research, or how to test it in their practice. The list goes on what they talk about. These are very valuable meetings to attend and participate in, and they may provide options to get more involved with quality that would be unforeseen if you did not participate. We're not just talking about the CT meeting or the cardiothoracic department meeting. There's VAD meetings, thoracic meetings, ICU conferences, ECMO work groups, blood conservation meetings, the list goes on. I personally at least have 3 meetings a week that are involved in like ICU, VAD meetings, and ECMO work groups. And they're great because you just gain a whole wealth of knowledge, and you just figure out there's so many team players out there and team members that you can work with and take great information from. Talking with your preceptors at your rotation site will help you navigate what you may be able to participate in. There's also like hospital library resources at the hospital you're going to be rotating at. Those librarians in there are amazing and can help you find anything. There's also statistical and data managers that are usually at hospitals. So when you start your job or even maybe on rotations, you might be able to utilize some of them or work with some of them. But it's just a really good, exciting to go out and be on rotations and know that there are resources for you to take not only on your rotations, but when you start your job as a perfusionist. Another good resource is utilizing national databases. Now, national registries are very helpful databases. They work by accumulating data and information from agreeable participants who want to participate, and they turn out results and outcomes to which we may benchmark ourselves in practice. The Society of Thoracic Surgeon National Database, or the STS database, as we all know it, was launched in 1989. It's a comprehensive collection of clinical data used to improve quality care in cardiothoracic surgery, and it's a critical tool for surgeons, hospitals, and researchers. This is a voluntary registry and is known for being the gold standard of quality improvement in patient safety in cardiothoracic surgery in patients above 18 years old. Even if you don't think your hospital are participating, most likely they are. You usually have a team of data managers in the background that's inputting all of this information for you. Or you can be lucky enough that you have to input it yourself. This large database captures about 95% of all cardiac surgery procedures. All the data is collected and de-identified to protect patient privacy. And to date, they have data on nearly 10 million cardiac procedures from more than 4,300 surgeons. It's used by many providers to measure quality in patient care and outcomes. Participating in this practice can be practice changing for some doctors. It's a very intensive database that can provide data for a multitude of research projects, change in practice, or just how to improve within your hospital. Now, the STS breaks it down, all of its information. It has more specific databases and sub-registries, the main one being the adult cardiac surgery database, but they also have one for general thoracic surgery, congenital heart surgery, InterMAX and PediaMAX, which we use a lot, which covers pediatric and adult patients who receive mechanical circulatory devices. And as previously stated, our professional society of AmSECT states in their standards and guidelines that we should be collecting and reviewing data, which is why AmSECT supports Perform as its national perfusion registry. Perform is a quality improvement registry that was created by perfusionists for perfusionists. It's a clinical registry that exists to collect data concerning the practice of cardiopulmonary bypass and cardiac surgical procedures. They accomplish this by collecting data from every case at participating voluntary centers. This data includes everything from circuit size, anticoagulation methods, times, drugs, so forth. What did you collect ANH? Did you wrap and VAP? Did you hemoconcentrate? Well, when did you hemoconcentrate? Did you give your ANH back on bypass? Did you not? It's very specific and geared towards just perfusion. A very important benefit to Perform is that before participating cardiac centers data is submitted to the STS, their Perform data is audited with their cardiac data to verify all the information is being submitted. Hold on, let me start that again. Their perfusion data is audited with their cardiac data to verify that all the information being submitted to Perform and the STS data are correct and they have the same values. This Perform to STS match will hopefully allow for only good data going in and not having bad data stay out. I think sometimes people are worried about people fluffing the numbers or making themselves look better, or practices making themselves look good. The thing is that we have to be honest with ourselves, with our practice, to be able to know where we can improve. So as perfusionists, it's our responsibility to participate in something kind of like Perform, to make sure the collection form is filled out correctly and sent out to be collected into the database. And by putting the work in and time after each case, which pretty much only takes about 5 minutes, and I actually do my Perform during my case, so it's just kind of streamlined, and at the end I'm done. You can go back to the database after that and review various metrics if you have any questions, and you can break down certain parameters, which is really neat, like procedures, fluid management, transfusions, incidence of AKI. My practice before we started Perform still had our own database like this, and it was kind of neat. We could see all of our parameters that we wanted to because we had a form kind of like Perform. And it really helps see, like, hey, your platelets somehow, how do you do your practice? Because you somehow have a higher percentage of platelets, after bypass, and it helps us open that conversation and help for that quality improvement. So not only can you see, what others are doing in your center, you can see what other centers are doing more of, or what equipment they might be using. It can really give you a good sense of what is out there and what is current in our practice. This can help you build quality improvement or quality assurance projects by seeing others' outcomes in areas where you may improve. Another benefit to being part of a national perfusion database is that every quarter Perform sends out a blinded data from all participating sites This allows for benchmarking and to bring awareness into what each institutional goal should be and a resource for who to reach out to help meet that goal. So this is just kind of like what one of those little boxes will look like. I mean, there's so many parameters that Perform sends out, which is amazing because it's wonderful and captivating to kind of go through them. But down here, these numbers down here represent different hospitals. Let's say my hospital is number 16 over here. Or no, let's say my hospital is number 25 over here. And I'm number 25, and my acute kidney injury is almost, looks like about a little over 50%. And I'm like, wait, every time I go on bypass, why do I have all this AKI? Well, what I can do is number 25 is try to see what all of these centers over here are doing to see how I move my number with this arrow to the lower percentage of AKI after bypass. So that's what I want to, sit there and discuss techniques and see what changes I can make to maybe move my practice to being more successful or more quality improved to help the patient outcomes. This is something that we can really look forward to and participating in to help quality. This is just a little rundown of what Perform is. It encompasses 45 hospitals. This is in 2023. We need to update the numbers now, but in 2023, they had 45 hospitals in 16 states, 120 surgeons, and 208 perfusionists participating. But it's pretty neat what the impact it can have. And it's going to just keep growing and growing the impact that it has as we get more and more data. And the number one goal for participating in a database is to bring awareness and collaborate and learn from each other, and not to be punitive. You can't stress that enough. Maybe one center is doing better than another center in certain ways. So that center is going to learn from the other center, but I'm sure that every center can learn from each other. So another way we use quality is by trying to prevent something bad from happening. Of course, as perfusionists, we always want to prevent everything bad from happening. We are the worst case scenario thinkers. We want to outthink the bad things. We want to prevent things from happening. So kind of like how airlines have a black box to record all the good and the bad things. Well, as perfusionists, we have something called a patient safety organization. A patient safety organization is a very broad term. It's an entity that collects and analyzes and provides feedback on data voluntarily reported by healthcare workers. It's kind of like healthcare's black box. Now, these PSOs collect data given by healthcare workers. Most of the time, the items reported were near misses or catastrophic events. And the information that is given by healthcare workers is protected and can be given anonymously. But any information that are given to PSOs, so PSOs are authorized is protected. So PSOs are authorized under the Patient Safety and Quality Improvement Act of 2005 to provide legal protection to healthcare providers by allowing them to report patient safety data without the threat of information being used in lawsuits. So this encourages more people to be open and honest about reporting those adverse and near misses that happen. So they also provide data collection. So these PSOs, or patient safety organizations, collect patient safety data from healthcare organizations to analyze trends, identify risk, and develop strategies to reduce harm. They can include analyzing patterns of medical errors, medication issues, infections, falls. They help organizations understand the root causes of errors and provide evidence-based recommendations for improvement. And they also promote collaboration. PSOs facilitate collaboration between healthcare organizations. They also between not only the organizations, but manufacturers. And they provide transparency. They increase transparency in healthcare by ensuring that the patient safety information is shared in a way that supports improvement while protecting those individual people and institutions from legal liability. And so PSOs are public safety organizations too. You can't just go open one up and say, oh, I'm a patient safety organization now. They are both national and regional PSOs, but they have to be accredited by the U.S. Department of Health and Human Services. And these organizations, of course, like I said, can vary in different terms or services they provide and what focus they want to focus on. In summary, PSOs play a crucial role in advancing patient safety by creating an environment where healthcare organizations can share information safely and learn from each other and take steps to reduce harm to patients. So, for perfusionists, we do have a patient safety organization, and that's just perfusion centric. ORM is a perfusion centric patient safety organization, which is the first and only perfusion centric PSO in the world, which is also endorsed by AmSECT. It works hand in hand with AmSECT. It's accredited from the Department of Health and Human Services. ORM provides a safe space to report these near misses, non-routine events, and possible patient harm incidences. And in reporting those incidences, ORM provides protection to the person reporting. It provides protection for the person reporting. It analyzes the information that it's given, and it provides feedback to what it thinks it may better practice. This is from ORM directly. ORM has confidence that a database may assist in the development of national standards and guidelines, in part by using empirical experiences from all of us. It states that it believes that the aggregation of data from a large number of incidents could assist in understanding what safety initiatives are working and which ones might need revision or redeployment of resources. So hopefully benefiting the perfusion community as a whole, taking in, maybe we have no idea that someone's level detector or who knows near misses, it keeps happening over, but that repetitive incident is happening all around the world. Well, ORM does, and ORM can hopefully make those changes to make sure it stops happening and is no longer going to happen. They could, this could change industry standards and change a practice and change the equipment that we're using. So it has its own incident reporting system, and I think you can be a member, but it also allows you to report anonymously. So you can submit these reports for analysis on their website. The reporting is free. The data is received and processed. It is then used in the development of best practices used to improve patient care. It's also used by manufacturers to ensure they're doing what's best for patient safety. So it's free, and all you have to do is go on to www.perfusionsafety.org, and they have a little tab, and you can just report anonymously if you think you guys you have something to report. So we have mentioned AmSECT in the discussion, and we are all a part of my committee, a part of AmSECT. Now we want to further dive into how AmSECT is a great resource for perfusionists and students. AmSECT provides us and continues to update and modify our standards and guidelines for perfusion practices, including adults, pediatrics, and MCADs, which are mechanical circulatory devices. They're all found online on the AmSECT website, which is free to use when you become a member. For example, the pediatric population quality requires special consideration and tailored approach to provide the best possible care to all shapes and sizes of patients. The one-size-fits-all approach isn't the best option providing care for all these patients. For example, the size and makeup of circuit primes is incredibly important consideration and specific to pediatrics, because pediatric patients also often have smaller circulating blood volumes. They are not as big as me and you. The pediatric standards and guidelines provide recommendations for the best way to provide that quality of care that we're looking for, that optimization of circuit size, the makeup of circuit volumes, cannulas, and so forth. There's a wealth of knowledge provided to you by these AmSECT standards and guidelines, and all you have to do is take a look and find that resource for you. So we're going to share an experience how the entire state of Michigan was able to use these AmSECT standards and guidelines to move forward safer practices for patients. So in Michigan, they have this amazing collaborative called the Michigan Society of Thoracic Cardiovascular Surgeons. Here you can see there's a trickle-down map for the people involved in the collaborative. It's called the MSTCVS. The collaborative is made up of not only surgeons, but anesthesiologists, perfusionists, data managers, and others, because this is a collaborative where each subgroup has their own specific topic. And then under adult cardiac and congenital, you will see perform. the Perfusion Registry, and the Michigan Perfusion Society. Yes, the perfusionists are a big part of this collaborative, and one of the biggest things they have to contribute is their data collection registry, Perform. And it's been beneficial in many, many ways. So as we talked about before, this pay for performance with insurances, how do you get everybody, but how do you get everybody to show up and participate? I mean, that's a big group, big group of people hanging out. And how do you get everybody to show up to these quarterly meetings? Well, money helps. Hospitals need money to keep the lights on. Insurance companies prefer to save money. It's through these two mutual wants that we have a pay for performance. This pay for performance are predetermined metrics that allow for the insurance companies to reimburse the hospital once a certain criteria is met. This criteria are performance and usually quality-based metrics. Well, one of these pay for performances that was supported by Blue Cross Blue Shield is from members of all the Michigan Society of Thoracic Cardiovascular Surgeons to participate. This pay for performance came to the question of, how to make sure everybody in institution was represented, had a representative attending the quarterly state quality collaborative meeting. Well, because Blue Cross wants their practitioners to continue their education and collaborate with their peers and strive for best practices, and the hospitals want employees to be practicing best practices, they were able to come up with this pay for performance, and it's a win-win. So everyone is now participating at this meeting. So during these meetings, we have all these people assembled, and the perfusionists had a drive for wanting to promote and educate for best practices. And here, the standards given by AmSECT, Standard 12, about protamine and cardiotomy suction. Cardiotomy suction shall be discontinued at the onset of protamine administration to avoid clotting within the CPB circuit. You would think everybody does this, but guess what? They do not. Because protamine reverses heparin, and heparin keeps circuit from clotting off, and it sounds easy that once you give protamine, you should turn off your cardiotomy suctions, but surgeons do not. And there's a big group that does and a big group that does not. So the Perfusion at Michigan were able to use this standard and say, like, hey, we would like to help making this a standard of care across Michigan as a whole. They felt strongly this should be the standard that all the hospitals practice. And because they had this tool to support them professionally, they were able to convince Michigan Collaborative and the insurance company, Blue Cross Blue Shield, that this would be a good value-based reimbursement project, meaning that pay for performance to improve patient safety, prevent adverse events. Well, lo and behold, here's what they were able to do. You can see that these gray dots on the left, right here, and here, and here, and here, and even the smaller ones here, these gray dots on the left represent where hospitals started before this value-based reimbursement was instituted. And then you can see where when you throw money into the mix of like, hey, if you meet this metric, we will give you money. So all after the end of the project, all of these gray dots had moved to the blue, and the blue almost here had a very high rate of success and moving towards that standard now. So institutions that were already following standards also became a great resources for those who were not following the standards. It was a huge success and a great example of how this data can be used to bring out awareness and grow towards being best practices. There's many, many, many ways. Because quality improvement and this power of collaboration is a team sport, the biggest thing is we can always achieve more when working together. Quality is not a singular silo place. There's resources and people and teams to help everybody achieve and improve in quality care for everybody. Now we talked about resources, and during those resources, we talked about what makes up who you can have on your team, basically. Everybody can be on your team as long as you're contributing and you want them on your team. Perfusionists, physicians, data managers, geneticians, biomed guys, anesthesia associates, from nurses, technicians, everybody. Reaching out to other professional groups within and outside your team can help bring awareness to each other's goals and help you be successful. You might find shared interests and targets for better quality projects, and you just simply need to communicate and work together. And this is this is such a small slide of why this is important. This is just, but it's important because of our practice. You know, we have to strive to be better clinicians. We have to strive to be better people. We got into this profession because we wanted to help people. We don't want to stay stagnant. We don't want to just keep helping because we've always helped this way, and this is the only way we're going to help. And this is going to be important to us because it's going to improve our patient outcome and safety. And that, I think, is why we're all getting into this profession, in this profession. But it also enhances and add value to our field. You know, it gets us recognition. You know, we are a big part of this team of cardiac surgery. We're not just somebody to put in the corner and forget about with our pump. We are participants in this, and we need to strive to be better participants. You know, it can add job security, and in the end, in the long run, maybe increase our pay. You know, we are very valuable people in CT surgery, in our practice. But I think the biggest method is that we need to get involved, and it requires everybody to take a step out, maybe of their comfort zone, to get involved, to participate, to want to be able to participate, to discuss with other people, and to just, you are going to get out of it what you put into it. So we're going to take questions after this, but I was asked to talk about the AmSECT student membership, and we're going to talk about that right now, real quick. So we're going to talk about AmSECT student membership. You can, you know, of course, joining AmSECT student membership is free. But they also have something called the Student Involvement Committee. The Student Involvement Committee is a group of students run by students for students, is what they say, with perfusion oversight, I think is what Keith says. Pictured here are the co-chairs of the student committee. Keith Bryant is a perfusionist who works at Mayo Clinic, Rochester in Minnesota. And Danielle Nguyen is a perfusionist that works at Lucille Packard Children's Hospital in Palo Alto. It's in the Bay Area. These gentlemen are very serious about helping students out and provide a great resource. So what is this AmSECT Student Involvement Committee? This is kind of like a subset of being an AmSECT student membership. You get that first, and if you want to be involved and participate in more of a professional society, you're able to join up into this. These are current students from around the country who virtually meet once a month, and during the meetings, they discuss ongoing responsibilities and talk about potential projects. The committee is internally governed by a student council, and all members of the student involvement committee are part of the council, so don't feel like you're not going to be left out. Everybody participates, it sounds like. During the meetings, they discuss the ongoing responsibilities and talk about potential projects. They work on fundraising projects to help get students to help raise money and to get students to go to conferences, because we all know it's expensive. My stepson is going to perfusion school right now, and I've heard a lot of students, and money is huge because it helps when you get a little bit of money to go to these conferences, and a little assistance does go a long way. They've worked on designing fundraisings like the Heart Walk 2023, part of the AmSECT Student Council fundraising with perfusion students and some current perfusionists. They all participated in a 3-mile walk and were able to raise $2,600, to which helps sponsor some of the student attendance of the AmSECT conference in Louisiana in 2023. But they provide just a lot of other stuff for you guys. And they also work together to write and publish a bi-yearly student newsletter called AmSECT Tomorrow, which is kind of neat. I think you can just, when you're a member, you can go on there and look at it and look through it. It's really neat. The newsletter is geared towards those individuals who are still in school. Features a variety of information from tips and tricks like how to find housing orientation, book reviews, sections about goofs and blunders, so you feel like you're not alone because everyone's going to make those goofs and blunders, you know, and interviews from current perfusionists and other in the cardiac field. I think it's important to be involved in something like this because, like we were talking about, don't be a silo. Being that student, you know, you have to be able to be involved. You have to be able to start talking to people and networking. I mean, we're such a small community. I think networking helps you find good rotations, find housing, find whatever you're kind of looking for. You know, those questions, you need to ask those questions. Hey, I got somebody you can ask, you know. They can help you have student discussions so you feel like you have somebody to talk to if you have any concerns in your field or questions you need answers. You know, interview prep and resume prep. Both Keith and Peter work with you guys to help you get ready for interview and answer any of these questions, which I think is super important, because a lot of times I don't think you know what resumes need to go on your resumes, what doesn't need to go on your resume. They help with interview prep. This is all uncharted territory, once you get out of school. Most of us haven't done this before. But it's just a great way to get involved and get your name out there and get some more experience of what is really out there. Of course, you have to get involved. You always get in what you put out, or get back what you put in. Becoming an AmSECT member, student membership is free. To get involved, you have to be an AmSECT member first. Once you have your student membership, you can email the AmSECT HQ, studenthq@gmail.com, or email amsect@amsect.org, or look at the AmSECT Student Corner, which is a great resource to get you those links and maybe hopefully connect you up to where to apply to and get involved there. I think, does anybody have any questions about that? I think now we're ready for question and answers for anybody have.
Thanks, Allison. That was a great job. We do have one question. One of the questions was, what advice, this is to the panel, what advice do you have for organizations where you see room for quality improvement, but practitioners are resistant to change?
What advice do you have for organizations where you see a room for quality improvement? I feel like there's always, absolutely, because everyone's going to be like, I do it this way, I don't need to explain myself 100%. But I think you still have to be an advocate for your own practice. And it is hard, and it is a fine line, but sometimes going at it different ways, or maybe, getting other team members that you probably wouldn't see, like, you don't want to gang up on somebody or tell somebody they're wrong, but you also don't want to jeopardize your own practice. I would think that going out about a different way, but politically correct way of not making sure everyone's being heard. Maybe the person who doesn't want to have change just doesn't have a way of telling you that they're doing it right because of a certain way that you didn't see. But does anybody else have any more concerns? That is a hard question. That is a very hard question.
I have a suggestion. I mean, I think I'll probably say something a bit controversial, but I think as a student, I think these are great thoughts. And obviously, as a student, it's going to be very difficult for you to manage addressing this. So I would say, as much as we don't want to delay, if you have a passion for this, if you join a team where you want to make a difference, I would suggest, obviously, get your certification first, start running, and make sure that you're running solo, and then approach your chief, because you're going to need your chief's buy-in anyway. So I would approach the chief and I'd say, hey, how am I doing? I'm running alone now, taking call, I'm certified, everything going okay. And then I'd bridge it to this. I'd take one or two approaches. I'd say, okay, now that I'm here and I'm planning on being here for a while, is there a department function that you would like me to do? Is there something that I can do to make a contribution to the staff to take a load or a weight off of you? That's one approach. The second approach would be, hey, I've got an idea of how to get involved in the department. I would really love to channel, maybe looking at data and quality improvement. Is there something for the staff meetings that maybe I can engage in so that you can present at the staff meetings, and something maybe as a group we can target to make an improvement on? That would be my suggestion. Unfortunately, as a student, I think anytime a student says something that's other than a question, it's met with resistance anyway. And let's face it, I think overall people in general don't like change. So I mean, I think it's always a tough road. I think if you have passion for it, I think if you're driven, I think if you find a nice way to craft it into a question of trying to do a duty to the staff, I think it'll be better received. And at that point, if indeed you've got the chief's buy-in, who more to lead the charge of what you want to do?
That's
I
great.
think that's really good, yeah. You might not be able to do it what you want right away, but if you go about it a different way, like you said, and like participate somewhere else in a different area with the chief's knowledge and appreciation, then maybe you're able to loop it back to maybe what, you have an interest in and advocacy in.
Yeah. And then and I think, following in with the policy and protocol, you can always ask like, hey, I want to make sure that I'm following policy and protocol. And if you feel that maybe it needs to be updated because it isn't following the standards and guidelines, of our profession, then that's also a way to kind of bring that up as a means of quality improvement.
I would agree wholeheartedly. A lot of times when you see something that's sort of unexpected as an outcome, like your outliers or an increased incidence of kidney disease or kidney injury, it's a great idea to just, okay, this is what I'm seeing. Then you can talk to your chief, your other perfusionist. Hey, this is what I'm seeing. How do I make sure that I don't cause more harm than I intended to? You don't always have to come at it as a hammer. You ask questions as an opportunity to make yourself better and your team better. It's sometimes a little easier than trying to do the bull rush in and say, this is what we got to do.
Yeah. More diplomatic too. Usually, yeah. So another one was like, how can one start a quality assurance as a team or organization? Where can one start? I think as our team started, we already have a lot of resources at our team, so we're very fortunate that way. But even as a small team, we were only like 7 people. We still wanted to look at a lot of different metrics. And so a friend of I work with, he learned macros, and we started using Excel spreadsheets that we were able to put in macros, and we were able to start our organization. And the thing is, when I start new projects too, I always start really small. Like, what do I want to capture? And I pick the top 3 and I start capturing those, and then I make it a little bigger, and then I make it a little bigger, and then it gets a little bigger. And then it has this whole project to where I want it to be at the end. The thing is, sometimes taking on that huge project, like you're going to take over the world, you have to start smaller and then to get to where you want at the end. But how's anybody else's experience of starting quality assurance as a team?
Well, we actually use 3 databases here, believe it or not. Talk about overachievement. We started way back when as a hospital-based group, and we sat down with our IT department, and something like you just said, Allison, we utilized Oracle and put a database spreadsheet into play, and then built upon that. And we actually follow the patients right out of the hospital. That's assigned one of the staff. And we get metrics from post-op chest tube drainage, post-op weight gain, blood utilization, time off the vent, and it goes on and on. And we've done that for a long time. Then with Perform, I have a second database. So I think if you're part of an organization, maybe like Comprehensive Health, or you're part of maybe Alan's group, or you're part of a corporate perfusion group, they may already have a database in place that you can tap into and utilize for some data collection. You can always engage in Perform if you want. We're encouraging that. That comes with a bit of a price. Or nowadays, I'll tell you, it's I don't want to say easy. But with Excel and Power BI, a lot of data analysts are using AI and Power BI to really drive dashboards. And with a lot of the shared documents that a department can set up, that document can be accessible after your case. You can plug in your data. It updates the dashboard organically. And bingo, you've got reports, you've got everything. And it takes someone from IT or someone with some knowledge of IT to do it, but it's becoming easier and easier for the general average person to do.
Absolutely. But it just, like you said, Alan, or Jeff, it just starts with that small collaboration of information, and then making it bigger, and utilizing, like you said, those databases that maybe you don't know that your hospital is participating or has.
And I love, as a student, we were talking about one of the questions that one of the students posed, I believe, is, are these databases available for a thesis project? I think that is an absolutely phenomenal question. And the short and long answer, the short answer is, I don't think so. The long answer is, there are some people thinking about that. and having a little bit of trouble getting it off the ground. So if there is interest, by golly, we would love to hear from you, because I really think linking you up to maybe a place in, I'll go out on a limb, maybe a place in Michigan that's looking at doing an improvement project for their group, for their team, or for a group of hospitals. I don't think that would be too resistant to get someone to say, hey, you want a thesis project? You want to, that may not be a bad place to start, is something like Perform. You could call Levanova with the Essence, and I think, I can't remember their program name. I believe that there is some other database accessibility available to you, but I think that would be a wonderful thing to engage students in quality improvement through a thesis basis approach in some of these databases. But I don't know right now of anything available. I would, suggest maybe you write the people at Perform, not that there's anybody on this call that are part of Perform, but that might not be a bad question to propose to Perform or to AmSECT, since AmSECT and Perform are partners.
I agree with that.
Any more questions we have to access? Can we have access to the AmSECT database as a student to study from?
So currently, yeah, AmSECT itself doesn't have a database. It's just, it's basically it's supporting and kind of like a relationship with Perform, but Perform is its own separate thing, if that makes sense.
But there might be databases that you don't know about at school or at a hospital you're participating to. Like there's a lot of other resources too, maybe.
Exactly.
So, well, thank everybody for coming. Anybody have anything to add at all today? Thank you. Yeah, okay.
Oh, yeah.
Perfect. But thanks guys for coming. I really enjoy your participation with us, and we really appreciate you guys listening to us and taking some time out of your day to be with us today. And we can't wait to meet you all when you guys become perfusionists. So thank you very much, everybody. Okay. Thank you.
Bye, everybody. Thank you.
Thank you.
Everybody, thank you so much.